There's many dietary factors that might influence the endometriosis risk. Consuming red meat increases the risk of endometriosis, while increased consumption of long-chain omega-3 fatty acids present in fatty fish is associated with a decreased risk of the endometriosis. Women consuming a diet rich in trans fats are also at a higher risk of being diagnosed with endometriosis. One study found that women in the upper quintile, the upper 20% of the trans fat consumption, had a 48% greater chance of being diagnosed with endometriosis. Other foods might also play a role. Increased dairy consumption was associated with a reduced risk of endometriosis in one study. Dairy may also provide vitamin D, and higher predicted vitamin D levels are associated with further reductions in endometriosis risk. Eating more fruits and vegetables might also play a protective role. Endometriosis is a complex disease and it can cause debilitating pain, and it's often difficult to treat. Compounding the problem is the diagnosis of endometriosis is often slow despite women making multiple trips to their physicians. Support groups can be invaluable as they can provide a connection to other women who are suffering from similar symptoms and provide an opportunity to learn more about the disease and strategies for coping with and treating the symptoms. The pain and infertility associated with endometriosis is likely due to the increased level of inflammation. Omega-3 fatty acids have generated interest because of their anti-inflammatory abilities. These anti-inflammatory capabilities are likely one mechanism by which the omega-3 fatty acids help to prevent the development of endometriosis. Animal studies have helped to validate the importance of omega-3 fatty acids for treating the endometriosis. One study using an animal model for the endometriosis found supplementation with EPA, an important omega-3 fatty acid, reduced the inflammation of the endometrium, and it also reduced the levels of other molecules that are associated with endometriosis, like prostaglandin E synthase, an enzyme that's related to the chronic inflammation in endometriosis. Another study examined the effects of fish oil supplementation on an animal model of endometriosis and found that fish oil was able to reduce the incidence of the endometriosis associated adhesions. A large study found that women who ate greater amounts of long-chain omega-3 fatty acids were also less likely to develop endometriosis. Many lines of evidence suggest oxidative stress, which is caused by reactive oxygen species, contributes to several aspects of endometriosis. Therefore, it's not surprising that vitamin E and C, both of which possess considerable antioxidant properties, have been studied in the context of endometriosis. In a study of 91 infertile women, those with endometriosis were shown to have lower levels of vitamin C in their follicular fluid, which is the fluid surrounding the eggs in the ovary, compared to women who didn't have endometriosis. Women with endometriosis also had lower levels of endogenous antioxidant superoxide dismutase in their plasma. In another study of 78 women aged 18 to 40, a modest association was observed between endometriosis and increased levels of a marker of oxidative stress called thiobutyric acid reactive substances. Other evidence suggests lower intake of antioxidants, including vitamin E, C, selenium, and zinc, in women with endometriosis correlate with more severe disease. These findings suggest by increasing the consumption of antioxidants there may be benefit for the women with the endometriosis. Accordingly, in a randomized placebo-controlled trial, 59 women between the ages of 19 and 41 who were allocated to receive a combination of 1,200 international units of vitamin E, along with 1,000 milligrams of vitamin C or placebo each day for 8 weeks. And following the 8-week treatment period, 43% of the women who'd received the vitamin E and C combination experienced a reduction in the chronic pain. 37% experienced a reduction in pain associated with menstruation, and 24% experienced a reduction in pain during intercourse compared to the placebo group. Moreover, several markers of inflammation and oxidative stress were reduced in the peritoneal fluid of the women who took the antioxidants. N-acetylcysteine is a modified form of the natural amino acid cysteine. It exerts several direct antioxidative actions, and it helps to bolster the body's intrinsic ability to combat oxidative stress by aiding in the production of the endogenous antioxidant glutathione. Several animal and human studies have shown that N-acetylcysteine might be an effective treatment option for endometriosis. In one animal model of endometriosis, 40 rats were randomized to receive one of 4 regimes: amifostine, a DNA protectant with antioxidant properties, sometimes used to combat the side effects of cancer treatments; N-acetylcysteine, a placebo, or leuprolide acetate. Animals treated with the amifostine and the leuprolide and the N-acetylcysteine exhibited a decrease in the endometriotic lesion and a reduction in the levels of the inflammatory marker TNF-alpha. When the groups were compared, the greatest reduction were noted in the animals who received the N-acetylcysteine. Another study that examined the effects of N-acetylcysteine treatment in both human cell culture and in mice found it reduced the oxidative stress burden and the cellular proliferation in the endometriosis. These findings led the researchers to conclude: our model shows that antioxidant molecules could be used as a safe and efficient treatment for endometriosis. Additional positive results were noted in a study where 92 women with endometriosis were allocated to receive N-acetylcysteine or no treatment for 3 months. Those who received the N-acetylcysteine were administered 600 mg 3 times a day on 3 consecutive days per week. After the 3-month study period, endometriotic cysts were slightly reduced in size among the women who took the N-acetylcysteine, while a significant increase in cyst size was observed in the women who received no treatment. The researchers noted their findings for the efficacy of N-acetylcysteine were better than those reported after the hormonal treatment of endometriosis. Significantly, 24 women who took the N-acetylcysteine cancelled the scheduled laparoscopy, whereas only one single non-treated subject did so. The scientists who conducted the study remarked, "We conclude the N-acetylcysteine actually represents a simple, effective treatment for endometriosis without side effects, and it's a suitable approach for women desiring a pregnancy." Green tea is rich in compounds called polyphenols, and these have a number of beneficial effects. In particular, the green tea contains a large amount of a subclass of polyphenols called catechins, and of these, the most extensively studied is epigallocatechin gallate, or EGCG. EGCG is the most abundant catechin in green tea, and it comprises 50 to 80% of the total catechins. The EGCG and the other catechins have a variety of effects, and they might benefit women with endometriosis. They can inhibit the development of endometriotic lesions, inhibit inflammation, and exert anti-angiogenic effects. The anti-angiogenic effects of the green tea and the EGCG have been researched in the context of endometriosis. In preclinical research of endometriosis, the EGCG was able to decrease the growth of the endometrial implants and reduce the formation of new blood vessels to ectopic endometrial tissue. Resveratrol is a polyphenolic compound and is found in certain foods like grapes, peanuts, some berries, and red wine. In preclinical research of endometriosis, resveratrol treatment reduced the endometrial implants by 60% and the total volume of lesions by 80%. Resveratrol inhibited angiogenesis in endometriotic lesions, a potential mechanism for resveratrol's growth-suppressing effects on the tissue. Curcumin is a polyphenol and is derived from curcuma family of plants. Curcumin has anti-inflammatory, antioxidant, and anti-proliferative properties. Preclinical studies have suggested curcumin treatment could be helpful for endometriosis. Curcumin has shown anti-endometriotic effects by acting on cellular signaling pathways, such as inhibiting NF-kappa B translocation and MMP3 expression, and inducing apoptosis in endometriomas. For more on natural treatments for endometriosis, check out my other video on my website. For more on herbs, supplements, and natural treatment plans, check out my website.